Hello, everyone. Can you hear me?
Yes.
Yes, welcome to the program today. We have a very interesting topic today. The topic is understanding food portions and carbohydrate counting. The presenter will be Miss Rachel Lee. This is a short run of the program. Welcome. There will be a poll of 5 questions about metabolic syndrome. Please try to answer them and then we'll see the response. A short introduction of the speaker. The presentation will take about 30 minutes. And then question and answers, 15 to 20 minutes. And then a short video on YMCA for just 1 minute. And then we will end sharp at about 9 p.m. tonight. Some housekeeping. Please mute yourself during the presentation. Unmute only when asking questions. Please keep the questions short. And please visit our Facebook pages and click follow so that you will be updated on future events. All right. Thank you for coming in. So now I will introduce the speaker. All right. Miss Rachel Lee holds a Bachelor of Health Science Dietetics degree with honors from the University of Science Malaysia, as an international member of the Academy of Nutrition and Dietetics, and also member of the Malaysian Dietitian Association. She is currently working as a dietitian with AGSU Sendirian Berhad, and she had worked in Pantai Hospital Ipoh for 10 years. She's also a keen writer and has written health articles like vitamin and mineral supplements. Do you need it? Diabetic diet can be sweet. Diet for chronic kidney disease and mental health. She has also given numerous talks, topics like healthy diet, healthy heart, preventing allergy, diet for diabetics, weight reduction diet, nutrition for women's well-being and health, and also obesity and healthy diet. She has also gone on air and has given talked about topics like this: healthy eating on Active Channel, sugar and effect on a person's health on TV1, eating disorders, dietary and health needs during Ramadan, aired on RTM Perak. So without much further ado, I will call upon Miss Rachel Lee to give her presentation. Miss Rachel.
Thank you, Dr. Leong, for a very kind introduction. Thank you everyone. Thank you for sharing your time to attend to our Zoom section tonight. So my topic for today will be understanding food portions and carbohydrate counting. Basically, this is an education for diabetes patients and also their caregivers. But for those who do not have diabetes, it's actually good to know also manage your meal well by listening to this talk, okay? So basically, for diabetes, managed diet alone might not be enough to manage diabetes well. So basically, we will focus on 3 aspects. The first one, of course, is the nutrition or the diet part. So we have medical nutrition therapy, which is specialized for diabetes. The second one, we have to actually include the medical aspect. So we need Dr. Leong here and also others, medical practitioners to actually come in to work together. So for the medical part actually means those medicine, diabetes medicine like oral hypoglycemic agent as well as the insulin. And last but not least, we need to manage the lifestyle. So lifestyle here basically means those physical activity, and also for diabetes patients, they are encouraged to do self-monitoring of blood sugar at home by using a glucometer. So these are the combined strategy in diabetes management. But for today, we are only focused on our nutrition part. So if you are healthy, you do not have any diabetes, you want to stay away from getting diabetes, the prevention part, basically you need a balanced, healthy diet per day. But if you, let's say, want to aim for a dietitian, if you want a drastically weight reduction, okay, and to prevent yourself from actually getting diabetes, you need a high fiber diet. So for the prevention, basically you need a balanced diet and together with a high fiber diet. So basically for high fiber diet, we means that per day we do recommend 20 to 30 grams of fiber. And from where you can obtain fiber, basically when you take veggie, when you eat fruits, legumes, whole grains, then you can obtain fiber. Okay. Now, this is the Malaysian healthy plates that we are talking about just now. So always remember to stick to Malaysian healthy plates if you want to follow a healthy diet. So divide your plate into 3 compartments, quarter, quarter, half. So for the first quarter, it's actually the carbohydrate part. So carbo means those rice, noodle, bread, cereal, and how much you can consume, the exact portion later on we will share according to our slide. And another quarter is actually your protein, which is consisting of fish, poultry, meat, and legumes. So half of your plate should be filled with vegetable and fruits. So very simple, isn't it? Just follow the Malaysian healthy plate, quarter, quarter, half to attain a healthy and normal diet. Okay, but somehow if you have been diagnosed with diabetes, you want to know how to manage it well. So basically for diabetes, you have to have actually balanced diet. Besides balanced diet, you have to actually go on a regular meal. Okay, what we call regular meals, meaning that if today you have your breakfast at 7 to 8 a.m., so every day you have to actually make it a routine. You have to take between 7 to 8 o'clock. You can't say, okay, I actually wake up very late today, so today I plan to have my breakfast around 10 a.m. So that is not really recommended. So always remember to monitor the total daily carbohydrate. Our method here is actually through carbohydrate counting. So later I will show you how to count carbohydrate. Okay, by counting carbohydrate, you can manage your sugar level well. Then you can actually obtain a glycemic control better. Okay, so I need to stress again on monitor the total daily carbohydrate intake because the total amount is more important than the types of carbohydrate. Okay, so many thought that when they are getting diabetes, they have to totally avoid table sugar, or we call sucrose. Okay, this is actually not true because even table sugar, can be taken by a diabetic patient as long as they know how to count the carbohydrate. But always bear in mind that when you take table sugar in excess, I mean when you are taking them in excessive amount, it will actually lead to calorie intake and it will cause further weight gain. So that is another concern you need to watch out. Okay. Some actually ask about this artificial sweetener such as aspartame, astaxanthin, potassium, whether a diabetic patient can take or not. The answer is yes, they are allowed to go on artificial sweetener, but somehow the intake should not exceed acceptable daily intake level. So just for your info, one sachet of sweetener, basically it has only 18 milligram of aspartame. Okay, but then the ADI level allowed for aspartame is actually up to 50 mg per kg per day. So I would say they are safe for consumption, but you just need to watch out the portion because some artificial sweetener, they do have laxative effect. Okay. Now we move on to another nutrients. Actually, our focus is on the carbohydrate, but we also need to talk about other macronutrients like protein. So for the protein, if for those patients, diabetes patients, they only suffer from diabetes without any kidney or renal function impairment, such as diabetic kidney diseases, then they can go on the usual protein intake. Our usual protein intake meaning from 15 to 20% energy. Okay, just now we have already explained, right? 50 to 60% is actually a carbohydrate part, 15 to 20% is actually the protein part. But somehow for those patients who have actually suffered from kidney function impairment, such as chronic kidney diseases, this type, right, then they need to further restrict their protein. Normally, we will advise them to cut it down to just only 0.8 to 1 gram of protein per kg per day. We call it as cardioprotective nutrition. Of course, the bad fats such as saturated fat, trans fat, and also cholesterol. These three patients have to limit, not only for diabetic patients, but as a general advice to people, we will advise to cut down on saturated fat, trans fat, and also cholesterol. This is because these three can actually increase our risk of getting cardiovascular diseases, so bring them down, okay? But food such as those have been fortified or enriched with plant sterol, okay, imagine by taking plant sterol 2 to 3 grams a day, it has been proven to further reduce our total cholesterol and also our LDL cholesterol. However, for food containing plant sterol in Malaysia is very limited. It only confined to certain types of soft margarine and also milk, certain low-fat milk product. Other than that, hardly you can find any product which is enriched with plant sterol. Okay. Now, what about other nutrition? Other nutrition such as sodium, or we call as salt. Of course, you have to bring it down. Yeah, you cut down the salt intake, but in order to manage the blood pressure better, you increase more fruits, veggie, and low-fat dairy product intake. And people actually always talk about supplements. So is there any benefit by taking supplements on diabetes? I would say until today, there is no clear evidence on the benefit of using antioxidants such as vitamins A, vitamin C, vitamin E, selenium, and also herbs in diabetes management. Okay. So we focus on carbohydrate again. So this is my second time stress on the total amount. Actually, total carbohydrate intake is more important than the type of carbohydrate. And if let's say you are on insulin regime, say for example, so you should make the intake consistent day by day. Too little carbohydrate is basically not really recommended. So the too little means the intake is actually below 130 gram. So 130 gram we call it as 9 cal, less than 9 cal. So imagine one day we divide our meal into 3 main meal. So one main meal, at least you have 3 cals of carbohydrate. So later on we'll talk about what is exactly 1 cal, but just imagine 3 main meal, each meal minimum you need 3 cal. Okay, so carbohydrate counting can actually help individuals with diabetes to manage their diet better, to control their sugar level better. I'm here to actually dispel the myth that all carbohydrates are bad. So you may have actually heard of people saying this, but not to forget, actually many carbohydrates, they are also healthier options such as whole grains. So example of whole grain is like brown rice, wholemeal bread, oatmeal. Fruits, a lot of fruits, they are actually packed with antioxidant and also vitamins and mineral. And vegetable, also very rich in fiber. Other low-fat milk and yogurt, although they are carbs, but they are also giving us a lot of other nutrients like protein, sulfur, and so on. So what are the benefits of carbohydrate? Carbohydrate is actually our primary and preferred source of energy by our body. Now, our body don't prefer to use protein, and also our body don't prefer to use fat as energy, okay? The main and primary source should come from carbohydrate. And carbohydrate provide essential vitamins and minerals, such as what we have been discussed just now. So if you are taking starchy vegetable, if taking whole grains, you get all those vitamins and minerals. And it actually serves as an important source for dietary fiber as well. Okay, here there are two options of carbohydrate. So the left side is actually a healthier option, right side less than healthier. So you can see for the healthier option, this is actually one bowl of oatmeal. So mixed with low-fat milk and then packed with some berries. Yeah, so you can imagine this is a very good options of healthier carbohydrate. But on the other side, which is the right side, right? That one is actually less than healthy. This is a donut, and then it actually has topping with chocolate syrup and chocolate chip on top. So among these two, definitely we will advise patients to go on the left one instead of the less than healthier option. Okay, why we are talking about carbo counting today? Because carbohydrate is actually the nutrient which has the greatest impacts on blood sugar level, not protein and not fat. Okay, although they have very minor effect on blood sugar level, but not as great as the carbohydrate. And actually very flexible and very easy tool for patients, especially for those who want to manage their sugar level well. So this carbohydrate guidance can actually provide guidelines to caregivers, to clients who want to learn how to count their carbs. And as long as you know the simple mathematic, your plus, minus, okay, this type, then you can manage this skill well. Okay, take a look on this chart. So why we count carbs and we are not counting protein, we are not counting fat, because carbohydrate has the most significant effect on blood glucose, then only followed by protein. Protein is actually very minor effect, and of course the fat has even least effect on the blood sugar level. Okay, rise in blood sugar is influenced by these two. The biggest effect is actually the amount. So we always focus on the quantity of carbohydrate, but it also affected by the speed of digestion and absorption of those carbohydrate you are taking. So say for example, complex carbohydrate, complex means like rice, okay, like starchy vegetable, definitely digest longer than simple sugar. Simple sugar means table sugar or honey, okay, but we always focus on the total amount. Total amount is more important than the types of carbo. Okay, what are the advantages of carbohydrate counting? So we have already discussed, it's actually control sugar level better, and you can enjoy freedom. Freedom to eat what when you want to. Freedom to eat very little, especially when you are having mood swing, you don't want to eat, okay, then you can actually eat little. And for those who actually afraid of eating sugar, when you actually manage this skill well, you can also allow yourself to take table sugar. Okay, let's see what are those food containing carbohydrates. So we divide it into 4 categories. The first one is actually the grains, tubers, starchy vegetable. Second is the fruit category. Third one will be the simple sugar, the honey category. And lastly will be dairy products and milk alternative. Okay. Now, food containing very little or no carbohydrate at all include meat or other protein sources, vegetable except for the starchy one. Starchy you have to count, unfortunately. And for fats, you don't need to count the carbohydrate because it has no carbs at all. Okay, let's take a look on this recommendation for carbohydrate. Basically, international guideline, they do recommend 45 to 60% of energy intakes comes from carbo. Okay, but for Malaysian CPG clinical practice guideline, they only recommend between 50 to 60% of the overall calorie come from carbohydrate. But somehow the precise recommendation should be based on presence of comorbidity. Say, for example, patients having kidney diseases, then perhaps the carbs recommendation will be adjusted accordingly. And the patient's calorie requirement. And last but not least is patient's current intake. Say, for example, patient is actually taking 15 cal of carbohydrate. So we cannot ask the patient from 15 cal cut it to only 10 cal. So we have to actually go on gradually. Means you reduce it gradually from 15. Maybe you advise them to bring it down to 13 cal for the beginning, and slowly you adjust accordingly. Okay. So here, these are the tools we are going to use for our carbohydrate counting. So basically, we are using all these 4 household measurements. Later on, when I mention cup, I'm actually referring to this teacup. So 1 teacup is exactly 6 ounce. Okay, 1 ounce is actually 1330 ml. So 6 ounce, 180 ml. And a bowl with diameter 11 cm. Teaspoon, which means it has 5 ml, and a tablespoon actually 3 times the teaspoon, so 15 ml. So these are the tools we are going to use later. Okay, there's a magic number here, 15. Okay, always remember to count carbohydrate. You have to remember this magic number 15. Why 15? Because one exchange of carbohydrate or 1 count of carbohydrate is equivalent to 15 grams of carbo. Okay, now this is exactly 1 count. So for the grains, 1 count, 15 grams of carbohydrate is equivalent to half a cup of rice, or we can use our scoop, 1 scoop. 1 scoop of rice, 1 count. Half a cup of noodle, half a cup of oats, or maybe 3 tablespoons of oats, half a cup of macaroni. So this is all belongs to 1 count. For biscuit, 3 pieces of crackers is considered as 1 count. Half piece of toast is 1 count, and 1 slice of bread is considered as 1 count. So for starchy vegetable, say for example potato, 1 medium size of potato is 1 count, whereas for pumpkin, 1 cup is 1 count. Sweet potato, yam, tapioca, half a cup is 1 count, and big beans, right? Big beans actually 1/3 cup, we count it as 1 count. Okay. Now we move on to fruits. How to define as 1 count, 1 exchange, 15 grams of carbohydrate. So if those fruits are like apple, orange, persimmon, pear, 1 whole, medium size, we count it as 1 count. For pineapple, honeydew, watermelon, and papaya, 1 thin slice. How thin is the slice? It's exactly when you are going to a fruit store to get your fruit, they cut it nicely and pack into 1 packet. That is 1 portion or 1 count, 1 exchange. Okay, you don't cut it according to your preference, make it very thick. Yeah, that is not a standard portion. Okay, for grapes and longan, langsat, all these 3, 8 pieces as 1 count. Whereas durian, 2 medium seeds, we count it as 1 count. Okay. What about other fruits? Other fruits like banana. So banana, we have 2 types here. The smaller one is called banana emas, pisang emas. So for pisang emas, 2 pieces we count as 1 count. Whereas the big one like pisang berangan, 1 piece as 1 count. Guava and mango, half of it as 1 count. Mangosteen, 2 small as 1. Plum also 2 small as 1. Jackfruit and water apple, these 2, 4 pieces we count as 1 count. Okay. Kiwi, 1 medium size, we count 1 count. For prunes, 3 pieces. Dry date, or we call kurma, 3 pieces as 1 count. And raisin is actually 1 tablespoon equivalent to 1 count. Okay, now we move on to dairy products. So for dairy product, you can see if someone mixing desi, they are using evaporated milk. So half cup of evaporated milk is counted as 1 count, or 1 glass of milk, 240 ml, that is also 1 count. If they are using milk powder basically 4 tablespoons, count as 1 count. For yogurt, it's 3/4 cup as 1 count. Okay, normally diabetes patients, they will also go on some specialized formula which is tailored to their needs. We call it medical nutrition formula for diabetes. So for that one, right, in general means 3 scoop is equal to 1 count. But then in order to make it more specific, you have to always refer to the label of the tin to find out the amount of carbohydrate and divide accordingly. Okay. So after knowing that 1 count of carbohydrate, 15 grams is like, okay, maybe you have some idea now. 1 scoop of rice is 1 count, but you won't know how much you can take, isn't it? So the recommended portions of carbohydrate, the counting of carbohydrate, how much you can take for your main meal and also for your snack will be depends on your body weight and also your physical activity level. So to identify your body weight status, we are using body mass index, BMI. The formula is your weight in kg divided by your height in meter square. Okay, so how to determine, as I mentioned just now, by using BMI. So you actually need to get your body weight in kg and your height in meter square. After that, you just follow this formula. So after getting the answer, right, you compare with these three. Yeah, I mean adult, we are using this guideline, the WHO classification. So as long as your BMI is between 18.5 to 24.9, meaning that you are normal, you are having a normal body weight. But then if your BMI is less than 18.5, meaning that you are underweight. And if your BMI is more than 24.9, meaning that you are overweight. And when the BMI is actually more than 30, means you are obese. So you have to identify which category are you. But just now, during the pool section, I can see all of you are within the normal range, which is you are having a normal body weight. Okay, so congratulations to all. Okay, another method to determine your weight status is actually by measuring your waist circumference. So for male, make sure your waist circumference should be less than 35 inches or 90 centimeter. Female should be less than 31 inches or 80 centimeter. Okay. So in order to determine your energy requirement, we are referring to this chart. So I believe all of us are staying a very sedentary lifestyle, hardly any exercise, even exercise perhaps 1 week 3 times, even 1 week 3 times, half an hour of walking, we also referring to sedentary lifestyle. So we are using quick method by counting energy requirement. You use 30 kilocal per kg. So if you are having normal weight, right? How to know you are having normal body weight? By referring to your BMI. So the counting, you should use current weight. You replace here. Okay. But then if you are overweight and underweight, you have to get one more step, which is to identify your ideal body weight first. Okay. Now, say for example, someone who is overweight here, the body weight is actually 80. Imagine that is overweight, right? So we cannot calculate energy requirement using 80 kg. We have to identify the ideal body weight first. So how to identify the ideal body weight? Again, we are using the BMI formula. So here, ideal body weight BMI, we actually use a 22 here. Why we use 22 here? Because this one, the range of normal is between 18.5 to 24.9. So we are using the middle. The middle is actually 22. Okay. So 22. And if your height is 150 centimeters, say for example, so your ideal body weight becomes 1.5 times 1.5 times 22. And you get it 49.5 and make it round up to 50 kg. This is your ideal body weight. This is a method to calculate your ideal body weight. But somehow, if you think that this method is a little bit complicated for you, then we have a quick method for you to calculate your ideal body weight. Quick method of ideal body weight, very easy. Basically, you use your height in centimeter minus 100. Say, for example, your height 150 centimeter. So your ideal body weight becomes 150 minus 100, that is 50 kg. Okay, again, this is our quick method to calculate your energy requirement. So we are using 30 kilocal per kg. Imagine every one of us here are staying a very sedentary lifestyle. So, okay, to calculate your energy requirement, if you are having normal body weight, you use your normal weight. But if you are overweight and obese, you find out your ideal body weight first. So just now, the example is actually using 50 kg. So energy requirement become 30 times 50, which is 1,005 kilocalorie. That is how we count patients' requirements of calorie. Okay. But then from this amount of calorie, how many carbs can you eat? So here we have to do a little bit of the mathematic calculation to determine how much carbohydrate you can consume. So remember the recommendations is actually between 50 to 60% of your overall calorie coming from carbs, isn't it? So this amount you have to times 50 to 60%. And after you times 50 to 60%, that answer you have to divide by 4. Why we have to divide it by 4? Because 1 gram of carbohydrate provides 4 kilocalorie. And that answer you have to divide it again by 15 because our magic number is 15, remember? So one exchange of carbohydrate is equivalent to 15 grams. So the answer for this 1005 kilocalorie is actually you can consume between 13 to 15 counts of carbo per day. Okay, of course, when your calorie is higher, like 1008, 2000, 2020, and 2005, right? The exchange of carbohydrate allowed to you is actually getting more and more. It depends on the calorie requirement. Okay, but our example today is actually 1005. For 1005 kilocalorie, one can only take up to 14 counts of carbohydrate. Okay, now what are the example of carbs distribution for 1005 kilocalorie, 14 cal, right? So we can actually distribute like this 3 main meal and there is 1 afternoon tea in between. So for the 3 main meal, breakfast, lunch, and dinner, we make it consistent amount. So that is 4 exchanges, and afternoon tea, we make it 2 exchanges. Or you can actually break it into another one more snack. So maybe you can have another supper before you go to bed. So if you have another supper means your afternoon tea, you bring it down to just 1 cow and supper another 1 cow. But the total, you should follow the 14 exchanges. Okay, what are the example of 4 counts of main meal? So for breakfast, basically we will recommend if you like to take break, go for wholemeal break because of the fiber content, and then you can actually take up 1 cup of low-fat milk. Okay, and also 1 fruits here. So how to count as 4 cow? So 1 slice or break is 1 cow. So 2 slices here means 2 cow. 1 cup of milk is actually 1 cow, and 1 apple is 1 cow. So 2, 1, 1, exactly 4 cow. Now, what about the butter here? Butter is fat, right? So for fat, we don't need to do any counting. So there is no cups counting for butter here. So in total, it's 4 cow here. Okay, for people who like to go for tosse, okay, this is tosse. So half piece of tosse is 1 cow. Remember that. So 1 piece means 2 cow. But here, somebody is actually having 2 slices of tosse. So here already 4 cows. But what about this gravy? This is only gravy, fish gravy without potato. So for gravy, we don't need to do any counting. And this is plenty, meaning there is no sugar to be added. So for plenty, also 0 cow. So this is one of the example of 4 cows also. So means if let's say he or she doesn't like to take break for today, so he can always replace by having chapati. So it's like flexibility. Patients need not to eat the same meal every day, repeat and repeat again. Now, what about lunch? Normally, lunch we prefer to go on rice. Yes, definitely all right for the diabetic patient because as long as you know how to do the counting, then you can allow yourself to go on rice, to go on bread, to go on maybe porridge, so far and so on. Now, how to do the counting here? Here is actually 2 cups of rice. So you still remember half cup of rice is 1 cow. So 1 cup means 2 cows. Here 2 cups is exactly 4 cow of carbohydrate. But what about this? This is curry chicken, but then there is no potato here, so you need not to count any carbohydrate. This is stir-fried spinach, also no carbs at all. Vegetable, as long as they are green leafy vegetable, you don't need to do any counting. And this is only plain water with ice, so no need to do any counting. So here the carbs is only coming from the rice. Okay. Now, what about porridge? Okay, porridge, yes, because it's actually coming from cups as well. We have to do the counting. So 1 cup of porridge equal to 1 exchanges, 1 cow. Here is actually 2 cups. So 2 cups mean 2 cows here. But what about anchovy? Anchovies is protein, you don't need to count. What about tauge? Tauge is also veggie, you don't need to count. But grape, yes, you have to do counting. Here is exactly 16 pieces of grapes, so you have to make it 2 cows here. So 2 cows from porridge, another 2 cows from grapes. So this is another example of 4 cow for lunch. Now, dinner can I actually take fried noodle or not? I would say yes, why not? As long as you do the counting, it's fulfill 4 count, you don't exceed the amount that you are allowed to take, then you can actually go ahead. Yeah, so how to do the counting here? So noodle, basically 2 cups of noodle, 4 count. What about prawn, egg, and also this chive, the veggie? So for prawn, they are protein. For egg protein, we don't need to count. Chive is leafy vegetable, isn't it? So we don't need to count. And make sure in order to enjoy a plate of fried noodle, your drink, your beverage should be sugar-free. So again, this is plenty, no sugar to be added. So the whole meal is exactly 4 count. Okay, if let's say your patient tell you that, okay, today I would like to go on Western meal, would you allow? The answer is yes, you can allow a patient to go on Western meal. Okay, Western meal, this is the chicken fillet. Chicken fillet is protein, we don't need to count, so it's like 0 count. And this one, the salad also you don't need to count. What about mushroom? Mushroom is vegetable, you don't need to count also. But potato, yes, you have to count. So here is about 2 knots of potato, which is 2 count. And then 1 slice of honeydew, you have to count as 1 count, and 1 bun here. So 2 from potato, 1 count from the honeydew, and 1 count from bun. Add up all total 4 counts for dinner. Now, these are the example of snack. Okay, basically for snack, we only advise between 1 to 2 exchanges. So he or she can take half piece of toast, 1 slice of bread, 3/4 cup of yogurt, 3 pieces of biscuit, 1 medium size of apple, and maybe 1 thin slice of honeydew. Okay, so there are a lot of food in a packaging whereby you will know how much carbohydrate is inside. So our advice is always to read the label, because by reading the label, you will know the amount of carbohydrate, and your focus should be on the total carbohydrate instead of the sugar. Don't look at the sugar, because sugar is only part of the carbohydrate. So you look at total carbohydrate. So for this food, right, we know that 1 cup, which is 1 serving, it has 10 grams of carbohydrate. So by taking 1 serving, the carbs is about 1 exchange. Although it's lesser, but you just make it round up. Yeah, that is 1 exchange of carbo inside. Okay. So with that, I would like to say thank you.
Thank you, Rachel, for an excellent presentation. Yeah, you can unmute yourself and
Yeah.
then ask the question, please. Yes.
Thank you, Rachel.
Okay, yeah.
This is Vicky. Thank you for your talk.
Hi.
Very informative. But sorry that we can't get in everything about the counting. So I don't know whether we can. Can we Google and get the number of counting and all that for ourselves or from you?
Yes. In fact, you can Google and get it. It's available in the internet. But if you want to get more info, I can actually share to you as well. So perhaps you can leave your email address here in the chat room, or maybe you can leave it with Dr. Leong. Yeah, I shall email you the detail later on.
Yeah, it is very interesting, but then just that we cannot get everything, the counting and all those things. Quite simple actually, but once you have once we have the notes and all that, it will be very simple to count. So thank you very much, Rachel.
You're most welcome.
Thank you.
Yeah, welcome.
Sorry, Rachel. There's a question down there by Sharon Keong. She said, how about GDM management? Is it similar management?
Yeah, okay. Thank you, Sharon, for your question. So for GDM, gestational diabetes mellitus, right? So this one basically is similar, but then the calorie requirement, the counting is slightly different. So for us, we are using the 30 kilocal per kg per day, right? So for pregnancy for second trimester, for the first trimester, there is no increments in terms of energy. So you just stick back to our usual energy requirement calculation. But then for second trimester and third trimester, there will be additional calorie required by the pregnant mother. So you have to add additional calorie. So yeah, so for gestational diabetes mellitus, right? Basically for pregnant mother, the energy requirement is slightly higher, especially during second trimester and third trimester, isn't it? So for first trimester, there is no energy increment. So you just need to follow our usual method of calorie calculation. But then for second and third trimester, if let's say second trimester, we have to add additional 360 kilocalorie. Okay, and for third trimester, you have to add additional 470 kilocalorie. So by adding this amount of calorie, then we have to actually find out the percentage of carbohydrate, right? So for GDM, we actually advise a lower amount of carbon percentage. We actually aim for just 45% from carbohydrate. So you count the total calorie times 45%, and then you divide the 15 again. Follow our method just now. Thank you. Thank you for your questions too.
Hi, Rachel. Thank you so much for the presentation. Yeah, so I actually have questions about pre-diabetic people with pre-diabetic condition. So let's say like if this person is overweight, and then like you mentioned in your presentation, we should aim for weight loss, like let's say 500 calories in a week every day. So I'm just wondering, like, let's say I want to like reduce 500 calories every day. Should I minus it from the ideal body weight, or with like the current calories that this person is eating?
There are two ways of measuring the calorie requirement. So if you are using the ideal body weight, right, you don't need to minus anymore, meaning that you actually calculate the energy requirement based on ideal body weight. But somehow if you are using the current body weight is actually overweight one, isn't it? So the current body weight, you have to minus 500 to 1000 kilocalorie. So it depends on which method you are using. But I would prefer you calculate by using the ideal body weight, so that you need not to do any reduction in calorie counting.
Oh, okay. So like, if let's say the person is not overweight, I can just use ideal body weight, is it? If the person is normal weight, I can also use ideal body weight.
Can, but then if you are having normal body weight, right, you can use your current body weight to calculate. That will be more accurate. Yeah, because if you are normal, you don't need to aim for weight reduction, so you don't need to count your ideal body weight.
Yeah. Okay. Yeah, thank you so much, Rachel.
Most welcome.
Any more questions? Yep. If not, then I ask Rachel. Yeah, you don't count butter and all this fat.
Yes.
Why is it so? Because it contains a lot of energy, isn't it, right?
Yeah, but then fats, basically they do not contain carbs. They have no carbs at all, so you don't need to count that. But the energy part, yes, you are right. So basically for the fat portion, right, we will advise them to cut down on the overall fat intake, basically. But you don't need to count because they do not have any counting in terms of carbohydrate.
What about alcohol? It's also quite a lot of energy if you drink a fair bit of it, especially beer, that kind of thing. They drink a couple of cans one go. How do you consider the beer?
Okay, so for alcohol, basically we do not recommend them to count the carbohydrate, because alcohol is not metabolized into sugar. Alcohol is actually metabolized in manner similar to fat. So we do not actually recommend people to do the counting on carbo. So for men, right, one actually can take unit of alcohol per day. To depends on what you mentioned. If that's 1 unit, and if you are taking those hard liquor, only 45 ml as 1 unit. So you stick to this guideline for alcohol. You need not to do any counting, and always remember to take alcohol when your stomach is full.
Any more questions from the floor? It's a very interesting talk, actually.
Hi, Gunnar here.
Hi, Gunnar. Yes.
How are you?
Okay, fine.
Basically, very simply, how to keep down sugar level.
So your question is how to keep down the sugar level. You mean how to bring down the blood sugar level? Is that your question?
Yes, yes.
Okay, in order to bring down your sugar level, in the very beginning, we have to talk about the combined strategy. So the first one, of course, you have to follow a nutrition part, which is our method today is actually counting carbohydrate. And then second one, perhaps you need to go on medication if your sugar level is not very good control. And third strategy is actually lifestyle. Lifestyle meaning that we encourage you to go on exercise, and you can also do self-monitoring of blood sugar at home.
Mm-hmm. What about fruits? I understand
that fruits can be
not food also.
Not really. In fact, all types of fruits can be taken. There is no restriction on fruits, but just that you have to watch out the portion. Again, it's the amount of carbohydrate. So normally for fruits, we can allow like one exchange during main meal, or maybe you can take fruits as a snack, no problem. But just limit to just one, because especially when you are eating main meal, you take together with rice. So that rice already count for 3 exchanges, say for example. So you allow additional 1 exchange is from fruit.
Reason why I asked this is because yesterday I went for I had no problem with sugar previously. Yesterday I went for a blood test, fasting sugar test, 5.6 on the dot. That's why I'm a bit concerned,
Okay.
Right? And, of course, the previous night, all right, I had a bit of a sugary dinner, and plus quite a few grapes and all that. I could have, contributed to that reading. So anyway, I just want to be careful, cautious, that's why I asked you this question.
Yeah. Yes, have to be very cautious, and then you have to learn how to control the portions of food that you eat. Not only fruits, but all types of food. You have to control the portion.
Okay, thank you very much, Doc.
Great. Okay, one more last burning question before we end the session.
You, Mr. Guna.
Yeah.
Any?
Richard, I just ask you a very quick question. So would you recommend carbohydrate counting for healthy people and also pre-diabetic people?
Whether we do recommend carbo counting for normal individual or not, I would say yes, you can use this as a guidance, but you no need to follow strictly because you are not diabetic. You can actually allow yourself to eat more amount of carbohydrate. But then for pre-diabetes patient, this should be as a very good reference for them, because they are at risk of getting diabetes, so it's better for them to manage the carbs counting well. So for pre-diabetes, it's like better for them to get to know certain knowledge about this education. But for normal individual, you need not to follow, but just as a guidance only, just as a reference only.
Okay, thank you so much.
Okay, great. I think we have had a great session with Rachel. Thank you very much for coming in and giving us this presentation. All right. I think we should have more of these presentations in future. Yes, and please remember to join our Facebook page so that you'll be updated on future events. So right now, I just show one little video clip, just a minute, and about what we do in YMCA, if you will allow me. Okay, great. So yes, I think we will end here now. Thank you so much for coming in. And if you have missed anything, you can go back to our Facebook page and review the video. It was live streamed actually. So yeah, I think there will be a permanent record there actually. So have a blessed weekend ahead of you. Yep. Goodbye. Thank you very much. See you all again next month.
Thank you.
Thank you.
Thank you very much. Thank you, Dr. Leong. Thank you.
Thank you.
Thank you.
Good night.
Thank you so much.
Good night.